Ayurveda is a science, a health science, which has got the holistic approach. I think all of you know that. But specialities or super specialities which are there in the modern medicine right now, is that new to Ayurveda? To yet another series of the shloka of the week. So today it's another interesting shloka which I want to take you through. This is also from Ashtanga Hridaya. Okay, and here if you look at the way the modern health science is going, the modern science, you see a lot of general physicians. Yes, apart from that, you have got eye specialists, ENT specialists. You have got chest specialists. Everything, you have got a lot of specializations which have come up of late. And nowadays, you know what? There are super specializations also coming up. But how was it in Ayurveda in those days? Okay, so this is very interesting for you to know that yes, there were a lot of in the previous shlokas we saw that Agniveshadi, a lot of authors have written a lot of books and they have done their own researches and they try to put across what they have learned. And Ashtanga Hridaya took all those things and made it into one, and that's the reason why it is called the Ashtanga Hridaya. And why it is exactly called Ashtanga Hridaya, we'll understand when we go through this shloka. Okay, so this shloka of the week is the sixth shloka from Ashtanga Hridaya Sutrasthana, first chapter, and this is how the shloka goes. Kaya bala grahordhvanga shalya damstra jaravrshan ashtavangani tasyahu chikitsayeshu samsrita. Okay, so you can see the transliteration. Kaya bala grahordhvanga shalya damstra jaravrshan ashtavangani tasyahu chikitsayeshu samsrita. So here we were just talking about special branches, specializations and super specializations which are coming up of late. In those days, each and every person had a liking towards a certain condition which he felt that he can handle better. Okay, so that is the reason we had 8 branches, okay, specialized branches which handled diseases in different ways. So that all the 8 branches put together, and the heart of that, and the essence of that is actually Ashtanga Hridaya. That is why Ashtanga Hridaya becomes very important. It contains all those things. Okay, so which are the 8 branches? We'll go through that. Kaya bala graha urdhvanga shalya damstra jaravrshan. Kaya means the body, so you can consider that to be the general medicine sort of, when people get fevers and pains and all those things, they come directly to a person with kayachikitsa. Bala means for kids. Okay, so they used to be specialized people who used to look out only for diseases for the kids, and the exponent for balachikitsa used to be Kashyapa, and one chapter on Vedana Dhyaya, which is very, very important for all of us, in the sense so much of minute detailing he has done. So if a child who cannot talk is suffering from a pain, what would be the way he would express it? Suppose he's got pain in his head, how will he keep his eyes? How will he, which part of the head, which part of the body will he touch? If he's got tummy ache, if it's on the left side, what does he do? If it's on the right side, what does he do? So all these things, it has been beautifully explained in Vedana Dhyaya. Okay, so this is very important. Kashyapa Samhita. Okay, you can go through that. Graha is, it's actually planets. Okay, so all these psychosomatic issues like having what you call epilepsies and mental issues, dementias, and all those things have been explained in graharogya. Urdhvanga, the next one is urdhvanga. Urdhvanga means the upper part of the body. Okay, that is the head. So anything above the neck. So normally ear, nose, throat, eye, and disease of the what you call head, and all those things, everything above the clavicle, so called, has been discussed in Urdhvanga. It is also called shalakya. And next is shalya. Shalya means discomfort. Anything which has come from externally and which can cause a discomfort is shalya. So usually what we do to remove shalya is by cutting and removing it. So the surgical aspect of Ayurveda has been dealt in Shalya Tantra. A lot of surgeries have been mentioned, how to do about, how to go, how to prepare a patient for surgery and how to go through the surgery and what you have to do post surgical things. And a lot of instruments, about 108, 110 instruments also have been enumerated in detail about Shalya Tantra. So Shalya was also a very developed branch in those days. Damstra. Damstra, the literal meaning of Damstra is fangs. Okay. So we understand from that that this branch actually deals with toxicology, poisons. You have got plants and animals, snakes, reptiles, all those things, spiders, scorpions, all those things which are poisonous. And if you get infected or you get afflicted by these poisons, how are you supposed to handle that? That has been explained in detail. That comes under the damstrachikitsa, or in other words, it's also called vishachikitsa or agada. Okay, jara means old age. Okay, so people actually get old, the body gets old. So how can we delay this? Okay, so some people consider this is also called as a rasayana chikitsa. Okay, so it is not basically anti-aging, it is how you can gracefully age. Okay, you can't reverse things. Yes, certain things have been told, like kuti praveshika rasayanam and all those things have been told, where what you call anti-aging things have been told, but by large, okay, the rasayana chikitsa has been told in this jarachikitsa. And the last one is the vrusha actually means, this is people may call it as the treatment to increase sexual potency. One part of it is yes, but this also handles infertility. If a person, a couple have got infertility, they have to go through vajikarana chikitsa. Vaji also means horse, and you become as powerful as a horse once you go through vajikarana chikitsa. So all these 8 limbs, okay, ashtavangani tasyahu. So these 8 limbs tasyahu have been mentioned chikitsayeshu samshritaha, for treatment, but the diagnosis and all those things, we use basically the same format for all diagnoses. But for chikitsa, yes, treatments has been divided into 8 branches. So that's what we mean by kaya bala graharogya shalya damstra jara vrushan. So this is the meaning of it. There's certain interesting things, okay. So kaya bala graha, okay, psychological, urdhvanga, eye, ENT, even the head, chirogas, shalya, damstra, vrushan. These are the 8 limbs and classified only for the purpose of management, for how you treat it. Okay, so when you look a little bit deep into it, these branching out was not new, not to Ayurveda. If you look at any part, if you look at even vastu or architecture, you have got specific thing, how you construct a house, how you construct a temple, how you construct something else, So we had branches there also. We have got temple vastu. Likewise, when you get into each and every branch in those days, into stream people were used to branching out. Likewise, even Ayurveda in those days, 5,000 years back, we were branching out. Super speciality or speciality is not something which is very new to Ayurveda. So there were Acharyas like Sushruta, who was an expert in surgery, Charaka, an expert in treatment, in general medicine. And if you look at what you call Kashyapa in pediatrics and all. So we had our own, and these things were not new to Ayurveda. Okay, thank you.